Nice to see you again. My name's Jamie. I'm a nurse practitioning student at Youngstown State University. I'm going to do a neurological and a musculoskeletal exam on you today, if that's okay.
Yep.
All right, perfect. So we're going to jump right into it. So we're going to start out with your neurologic exam. I'm going to start by testing your cranial nerves. So we're going to test cranial nerves 1 through 12, and we'll start with cranial nerve 1. So this is your olfactory. I'm going to have you close your eyes and occlude one nostril, and I'm going to have you take a sniff. What do you smell?
Almond.
Yeah, and then keep your eyes closed. Let's do the other nostril. And what do you smell?
Coffee.
Good. So you're able to detect scents bilaterally, so I have no concerns about your olfactory nerve today. So we're going to move on to cranial nerve number 2. So that is going to be your optic nerve. I had previously tested Courtney's vision in a prior assessment, and we did a Snellen chart. I have one right behind us. We did each eye individually, and then we also did them separately. Together, and she was 20/20 corrected vision because she has a history of LASIK. But we're also going to test it with the confrontation test as well again today, okay? So I'm going to have you cover one eye, and I'm going to cover the same one, and so we're going to test your peripheral fields here. So I'm going to have you just tell me what number I'm holding up.
2, 1, 2, 4.
Perfect. We're going to do the other eye.
2, 3, 2, 5.
Perfect. So I have no concerns over your optic nerve. So we're going to move on to cranial nerves 3, 4, and 6. So that would be your oculomotor, trochlear, and abducens. So we're going to test your extraocular eye movements as well as your pupillary response. So I'm going to start out with your 6 cardinal fields of gaze. Just follow the end of the pen light. Only your eyes. I'm just looking for any kind of nystagmus. You have really smooth transitions and eye movements. Perfect. Bright light, just look right at me. Good. Just checking pupillary response. Just look at the end of this again. Perfect. So her pupils are bilaterally equal, round, reactive to light and accommodation. They are 3 millimeters at this time. So that tells me that these these 3 cranial nerves are intact. So we're going to move on to your trigeminal. So this is going to be your facial sensation as well as mastication. So I'm going to be checking your jaw strength. I'm going to have you open up your jaw against me. Perfect. You have good strength there. I'm also going to have you close your eyes, and I'm going to touch your frontal, your maxillary, and your mandibular regions of your face. I just want you to tell me if this is sharp or dull.
Dull. Sure.
Dull.
Dull. Dull.
Sorry, that was me.
Sure. Sure.
Okay, sounds good. So cranial nerve 5 is intact. I would also just mention here that we would test your corneal reflex here. I'm not going to do it to you today, but it's where I would take a cotton swab and touch the outside of your cornea. If you ended up blinking, then that would be a positive reaction, okay? So next we are going to test cranial nerve 7. So this one's easy. Just want you to smile, frown, and I want you to puff out your cheeks. Perfect. So I have no concern over your facial nerve today. We're also going to just mention that we already tested your acoustic, so that would be cranial nerve 8. So in a previous assessment, we used the Weber and Renat, and I used the tuning fork on the top of your head, and you lateralized equally, as well as you had greater air conduction than bone conduction. So all of that was very reassuring. And then we also did a whisper test in that video, and I had no concerns over your hearing at that time. So we're going to move on to cranial nerves 9 and 10. So this is glossopharyngeal in your vagus. I'm going to have you open up, say ah, perfect. Your uvula is midline, your palate movement is appropriate, it rises your uvula when you say ah. I have no concerns there. I'm just going to mention it, but I'm not going to put you through it. You do have a gag reflex here, that's where we would test, and I do not have any concerns about your vagus nerve because you are talking without hoarseness in your voice and you're able to handle your secretions and swallow appropriately, okay? So the last thing we're going to do here is test cranial nerve 11 and 12. So 11 is your spinal. So I'm going to have you shrug your shoulders against me. Perfect. Look to your left. Perfect. To the right. Good. So you have good neck and shoulder strength there. And then can you stick out your tongue for me? Stick it up, down, side to side. Perfect. And then can you stick out against your cheeks and the other side too? Perfect. So your tongue movement is strong in midline as well. So all of your cranial nerves seem to be intact today, okay? So we're going to move on with your neurological exam, and we are going to test your cerebellar and your sensory functions, okay? So we're going to start out with coordination and fine motor. So with your hands, I'm going to have you do this motion on your thigh and get faster and faster. Perfect. And now I'm going to do finger to nose. So you're going to touch your nose and then touch my finger. Other hand now, same thing. Perfect. And we're going to do a shin and heel test. So heel, perfect, both sides. Great, so I don't have any concern about your cerebellar integrity right now. We're going to move on and do the Romberg test. So I'm going to have you stand up with me, feet together, arms across your chest. I'm going to have you close your eyes. And originally I would say that I'd have Courtney stand here for 30 seconds. I would be assessing her balance here. This is testing proprioception and vestibular function for her. You can also open your eyes after 30 seconds, and we would do this exact same test for 30 seconds. So now what I'm going to do is, while she's standing here, I'm just going to assess your gait, okay? So I'm just going to have you walk back and forth. Perfect. And come back here. I'm looking at your posture, your stride. It seems appropriate. While you're standing, I'm going to jump ahead and just do a weight-bearing test real quick because it's something I'm going to have to do a little later. So I'm going to have you walk on your toes over there. Any pain? Nope. And we're going to walk on your heels. Great. I'm looking at the arch. It seems appropriate on her foot. I'm also going to do tandem, and that's going to be heel to toe. Perfect. And I'm just looking at her balance here. Wonderful. And I'm just looking at symmetry. You can have a seat here. I don't have any concerns there. You seem to have 5 out of 5 strength. So moving on though with your cerebellar and your sensory, we are going to move on to sensory. So we are going to do, with a cotton tip applicator, I'm going to do touch and pain, okay? I'm going to have you close your eyes for me, and we're going to test your sensory pathways. So what I'm going to do is I'm going to touch you in different areas, and I just want you to tell me of what part of your body it may be sharp or dull, okay?
Left arm, sharp. Do you want me to say which limb?
Just sharp or dull right now.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Perfect. And I don't have any concern about your sensory pathway right now, okay? So we're going to move on to your position. I'm going to have you put your hands just like this. I'm going to have you close your eyes for me. I'm going to move your hands either up or down, and I want you to tell me which direction they're going.
Up. Down. Down. Up. Down.
Perfect. Same thing with your feet. I'm going to have you kind of stick your heel. We'll go like this.
Okay.
All right. So same thing. Close your eyes and just tell me if they're going up or down, okay?
Up. Down. Up. Up. Down.
Good. And so I don't have any concerns for your posterior column function right now. And so now we're going to do stereognosis. So this is just testing if you can make out familiar objects. I'm going to have you close your eyes and give me one hand. Can you tell me what that item is?
A key.
Perfect. And what about your other hand? Can you put that out? I'm going to put something else in there. Can you tell me what that is?
Paperclip.
Perfect. So I have no concerns there. You are able to identify correctly. So we're going to do a 2-point discrimination as well. I am going to use this. I don't have calipers, but I'm going to use this, and I'm going to touch you on different parts of your body. I want you to tell me if it's 2 points touching you or 1, okay? Close your eyes.
1. 1. 2. 1. 2. 1. 2. 1. 1. 2.
Perfect. And I have no concerns there. You identified them all correctly, okay? So next I'm going to have you put out your palm for me. And I am going to have you close your eyes, and I'm going to draw a number on your palm, and you tell me what number I'm drawing, okay?
3.
Perfect. Other hand?
7.
Perfect. And so that tells me that your cortical sensory processing center is intact as well. So the last thing we're going to do is I am going to touch you with light touch here, so the cotton side of my applicator. I'm going to have you close your eyes and just tell me the place that I'm touching you on your body, okay?
Left arm. Right hand. Right shin. Left shin. Chest. Forehead. Right arm. Right forearm. Left hand.
Perfect. All right, so that concludes right now this portion of the cerebellar and the sensory function testing. I'm going to just pause the video and we're going to return and we're going to finish up the neurological exam with your deep tendon and superficial tendon reflexes, okay? Okay. All right, so now we're going to continue on and we're going to check your spinal segment function, okay? And we do this by checking deep tendon reflexes as well as superficial reflexes. So I'm going to start out by checking your bicep reflexes. So how we're going to do this, this is testing your C5, C6 segment. I'm going to put my thumb right here, relax your arm. Perfect. And I'm looking for a muscle contraction here. And I'm going to move over to the other side. I'm going to do the exact same thing, relax your arm. Perfect. Perfect, and I'm looking for a contraction there. We're also going to test that C5, C6 segment by doing your brachial radialis. I'm just going to support your hand nice and flaccid here. Good. And I'm looking for a muscle contraction here. It's a little bit of twitching. We'll scooch to this side. Same thing. Nice and soft. Perfect. And this covers your brachial radialis, covers mainly your C6, whereas up here your brachial is your C5. Both are 2+ on both sides. So now we're going to check your triceps. I'm going to kind of scooch here so I'm not in front of the camera. I'm going to dangle at a 90 degree. I'm just going to hit back here and I'm watching for a muscle contraction here. And I see one, so that's +2. I'm going to scooch behind you. Same thing on this side. Just relax your arm. Let me hold it. Perfect. Your tricep is +2 on both sides. When we check your triceps, that's the C6 through C8 segment. So I'm going to move down to your patellar. So this is going to check your L2 to L4 segment. So just going to relax your leg. And I'm watching for a contraction in the quadricep muscle, as well as sometimes you can solicit a foot response here. There we go. Same thing on this side. Sorry, I'm doing it backwards here. And I can see a response right here. Next, we're going to move on to your Achilles, which is your S1, S2, as long as your foot is nice and relaxed. I'm just looking for a muscle contraction as well as a little bit of reaction in the toes there. And then same thing over here, that was a +2 on that side. Perfect. Okay, and the last thing that we're going to check here is I'm just going to check for clonus. So what that is nice and relaxed, leave your foot, let me manipulate it. Good, I'm going to scooch it up. I'm going to hold this. And when I release, I do not want to see any rhythmic movements. Perfect. This is assessing your motor neuron function. Just let me manipulate your foot. I'm going to hold it. And when I release, I should not see a rhythmic jerking movement. And I do not. So that concludes your neurological exam. That was all very reassuring. Do you have any questions?
I do not.
Awesome. So we're going to move on to your musculoskeletal exam, okay? So what we're going to start out with is I'm always just going to inspect, palpate, and then do a little bit of range of motion with you. So we're going to start out with your wrists and your fingers, okay? So I'm going to have you just kind of copy my movements here. So any pain, any abnormal nodules, just looking at
a scar on my hand there.
Just looking for symmetry. I'm feeling for tone. I am looking for warmth, any kind of crepitus. I'm feeling the MIP, PIP, and DIP joints of both hands. And I don't see anything abnormal here. I'm looking for any kind of, again, muscle twitching. Any pain?
Nope. Okay,
tone is appropriately distributed. So what we're going to do is just follow some of my motions. Okay, we're going to start with your fingers. Curl them in, extend them out, fingers together, fingers out, wrists down, wrists up, straight up. We're going to do, and radial deviation. Perfect. And we're going to do circles. Any pain with any of those movements? Wonderful. With your fingers, I'm going to have you open against resistance. Perfect. Pull up your wrists against me, push down against me. Any pain there? Perfect. So we're going to move on to your elbows. I'm going to have you hold your elbows up. I'm just looking for symmetry. I'm feeling your tone, feeling for crepitus. I'm looking for surrounding muscle atrophy, any kind of muscle separations. I don't have any concerns there. When I'm looking at the elbows, you can rest this arm. When I'm looking at the elbows, I'm just looking at the medial and the lateral epicondyles for golfer's elbow, tennis elbow. Sometimes we see that with patients when they come in. I don't, again, feel any crepitus. So what we're going to do is some range of motion here. So I'm going to have you, with your elbows, extend out, extend in. We're going to ladder that way, away from your body, down. Any pain? No? Okay. And then what I'm going to have you do is just push down. I'm going to put my hands here. Any pain in your elbows when you do that? Okay, 5 out of 5 strength there. I have no concerns with your elbows right now. So moving on to your shoulders, I'm just going to assess for symmetry right now, paying attention mainly to your deltoid and your trapezius muscles here. I'm just going to palpate for symmetry, dislocation, pain, crepitus. I'm going to kind of use my anatomical landmarks, which would be my suprasternal notch, and I'm going to palpate along the clavicle here to your joint. Any pain? Nope. Medial in here to this groove is your AC joint. No pain there. So we worry about rotator cuffs. And in the back, you're okay. All right. No tenderness there. Okay. So we're going to do forward range of motion, backwards, up, down, scratch your neck. Come in, scratch your back. Any pain with any of that movement, we're going to go across, perfect, and extend out like this. So it's complete full range of motion. If you had any kind of pain or tenderness, I would be concerned about maybe a rotator cuff injury, but I don't have any concerns there. I'm going to just test your shoulder shrug again. I know we did this once, perfect, and then move your shoulders against me, perfect. 5 out of 5 strength I would give her, no concerns there. We're going to move on and just kind of turning so we can see in the video, but I'm going to do your temporomandibular region. Open up your mouth, side to side. Perfect. Any pain? No. No crepitus was felt. Her functional assessment, she has appropriate bite strength. I would say it's 5 out of 5. So moving on, we are going to do your cervical spine assessment here. So what I'm going to do is I'm just going to move kind of to the back side here of your cord. I'm looking at your cervical spine. When I was in the front of you, your trachea was midline. I didn't see any surrounding muscle tissue swelling. Any tenderness when I'm palpating here? Nope. All right. You have normal curvature, normal warmth. I'm going to have you put your chin to your chest, chin up to the sky. I'm going to have you look left and right, ear to ear, ear to shoulder, and the other way. No pain? Nope. Perfect. And when we tested cranial nerve 11, we tested your strength of that cervical area, so I don't have any concerns there. I'm going to have you stand up here, and I'm going to just have you face the wall over here. Next, we're just going to do your thoracic and lumbar spine, okay? So I'm just looking at the curvature of your spine here. I'm looking for any obvious kyphosis, lordosis, scoliosis. I don't see anything abnormal. I'm just going to lift this up here. Now I'm going to palpate all the way down from C7 down to her sacrum here. I'm feeling for any step off of her vertebrae, which feels appropriate. I'm going to then feel for surrounding muscle issues, rigidity, pain, any pain when I'm palpating.
Feels nice.
What about down here?
Nope.
Perfect. So I don't have any concerns here. What I'm going to have you do is just bend forward for me, Courtney, touch your toes. I'm going to assess again for scoliosis. I'm going to move this up, feeling her spine here. While she's in this position, I'm just going to feel her hips for any disalignment to see if there's one that maybe is longer than the other, and I don't have any concerns right now. You can sit up. I'm going to have you extend your back backwards, bend back, perfect. I'm going to have you side to side and the other way, and I'm going to have you do a twisting motion, perfect. And I don't have any concerns for range of motion. Her functional strength of her trunk with the flexion and extension is a 5 out of 5 right now. So next we're going to do your hip assessment, okay? So I observed you walking before. I had no concerns over your gait. I just palpated there when you bent over. It doesn't seem like one leg is longer than the other. There's a disappropriation there. What I am going to have you do is just, I'm going to palpate back here. No tenderness. Right. Greater trochanter region, and then I'm going to palpate on your iliac crest here. There's no pain. Same thing on this side. Perfect. So some of the hip exercises you might need to hold on to the table, and that's totally fine. So what I'm going to have you do is 90-degree angle. We're going to pull hip up. Any pain?
Nope.
Okay. You can put to the other leg. Same thing, 90-degree. Your hip feels okay there?
Yep.
Okay, we're going to do out to the side and the other way. We're going to do front and back, same foot. Perfect. Same one, out and back. No pain in your hip?
Nope.
Okay, we're going to do across the front. Perfect. And the other way as well. And then we're going to do behind. So behind, perfect.
Like a curtsy.
Yes, it is. All right, no pain in your hips?
No.
You have good range of motion there. So I would say that she has 5 out of 5 strength in her hips as well. So Freddie, what I'm going to have you do is I'm going to have you lay down at this point. I'm just going to look, finish out your assessment. Right up here. So we're going to look at your knees and legs here. So when I'm looking at your knees here, I'm just looking for symmetry. I'm looking for any abnormal swelling. No pain on palpation. Tone is appropriate. The warmth is appropriate for her skin. Color is appropriate as well. I don't see any obvious swelling. I'm going to palpate your medial and lateral meniscus area. Also going to check your patella, your patellar groove. Right below that's your tibial tuberosity. That feels normal on your left leg. Then I'm going to palpate behind your knee here. This is where effusions often happen in this fossa area or Baker's cyst. I don't feel anything abnormal. Same thing, I'm going to palpate that posterior fossa, lateral and medial meniscus. Also going to palpate just your kneecap here, your groove, and your tibial tuberosity. Good, so I don't have any concerns while I'm palpating that. Next we're going to do a flexion, so can you bend your knees? Perfect. Any pain while you're doing that? Extend straight out. Both legs down. Perfect. I'm going to stabilize kind of your thigh. I'm going to see adduction and abduction here. You're going to feel me kind of push opposite. Your knee, just because of the collateral ligaments, really don't allow for much adduction and abduction. So I'm going to have you bend your knee at like a 20-degree angle here. It gives about a 5 to 10 give. Good. A little less. There we go. And I'm just going to let me manipulate it. Perfect. Now I'm going to bend your leg up here, 90 degree. You just relax. Let me hold. I'm going to manipulate your foot. So I'm just going to do medial and lateral. Perfect. And I'm going to do this one as well. Any pain when I'm doing that? No. Perfect. And you can rest that down. So I have no concerns right now about your knees. I would say 5 out of 5 strength there. So we're just going to finish up with your ankles and feet, okay? So I'm just looking at your ankles here and your feet. I'm just going to inspect. We already did the weight-bearing portion, so this is just a non-weight-bearing inspection, okay? I'm looking for symmetry. I'm looking for any swelling, any kind of deformity of which I do not see. I'm palpating for warmth, for crepitus, particularly at your malleolus. I'm going to palpate your medial malleolus, your lateral. I'm also going to palpate your calcaneus. No pain? No. Then of your metatarsals, your DIP and PIP joints. No pain here. No crepitus is felt either. All right, so the last thing we're going to do is just a range of motion. So I'm going to have you flex your toes up to you, down like a gas pedal, back up against me. Beautiful. Inversion inwards, eversion outwards, and can you do a full circle? Try with your ankle, each one. Perfect. And so you have normal alignment and contour. So do you have any questions today about our exam? No? All right. Well, I want to thank you for your time.
Thank you.
You're welcome.